You finish dinner. You sit on the couch. You feel that familiar wave of heaviness, the foggy slowness, the urge to do absolutely nothing. Most people accept this as normal. It's not. It's a metabolic emergency, and your body just lost the most important window of the day. There is a 30-minute period after every meal where one simple action can lower your blood sugar more powerfully than most diabetes medications. Melt visceral fat at a rate no gym workout matches, and rewire your insulin sensitivity within weeks. That action is walking. But not any walking, not whenever you feel like it, specifically within 30 minutes of finishing a meal. And what happens inside your body during that walk is so dramatic that researchers from the University of Otago called it the most underrated metabolic intervention of our generation. Stay with me. By the end of this video, you'll understand exactly why post-meal walking is the single most powerful free habit you can build for your blood sugar, your waistline, and your longevity. Here's what's happening when you eat. Your stomach breaks down the carbs in your meal into glucose. That glucose floods into your bloodstream. Your blood sugar spikes, sometimes to 160, 180, even 200 in people with insulin resistance. Now your pancreas panics. It releases insulin, the hormone that escorts glucose out of your blood and into your cells. But here's the problem. After 50, your cells become resistant to insulin. They don't open easily anymore. So your pancreas releases more and more insulin, fighting to push glucose into cells that are slamming the door shut. The result? Glucose floats in your blood. Insulin floods your system. Both are toxic in high amounts. Both drive belly fat storage. Both accelerate aging. And both are doing maximum damage in the 60 to 90 minutes after every meal you eat. This is why you feel tired after eating, why your belly feels bloated, why your brain fogs over. Your bloodstream is essentially a sugar swamp. Now here's the part nobody tells you. Your muscles have a hidden backdoor for glucose absorption that doesn't require insulin. It's mechanical. When a muscle contracts, it can pull sugar directly out of the blood, no insulin needed. This is called insulin-independent glucose uptake. When you walk, your leg muscles, your largest muscle group, become a glucose vacuum. They absorb up to 40% of the sugar circulating in your blood within just 15 minutes. You bypass the entire insulin spike. You skip the storage process. You drain the sugar swamp before it has a chance to damage anything. This is why post-meal walking is in a category of its own. Walking before a meal doesn't do this. Exercising in the morning doesn't do this. Only walking immediately after eating activates this backdoor. Let me walk you through what happens in your body during a 30-minute post-meal walk. Minutes 1 to 5, your leg muscles wake up. Blood flow shifts from your digestive tract to your extremities. You might feel slightly clumsy, slightly sluggish. This is normal. Your body is rerouting traffic. Minutes 5 to 10, the muscle pumps activate. With every step, your calf muscles act like a second heart, pushing blood back up toward your core. This circulation surge starts pulling glucose out of your bloodstream and into your working muscles. Your blood sugar, which was about to spike to 160, levels off at 130. Minutes 10 to 15, insulin demand drops. Your pancreas, which was preparing a massive insulin release, eases off. Less insulin means less fat storage, less inflammation, less damage. Minutes 15 to 20, digestion accelerates. Walking gently stimulates peristalsis, the wave-like contractions of your intestines. Food moves through your gut more efficiently. The bloating you feel sitting down dissolves. Gas releases. Your stomach feels lighter. Minutes 20 to 25, mitochondria activate. The energy factories in your cells, especially in your legs, ramp up production. You start generating real, clean energy from the food you just ate, instead of letting it sit and turn into fat. Minutes 25 to 30, cortisol drops. The rhythmic, predictable motion of walking activates your parasympathetic nervous system. The stress that built up during your day starts to fade. Your nervous system shifts from fight or flight to rest and digest. You finish the walk. You feel light, alert, satisfied. You haven't earned this with willpower. You've earned it with myology. In 2022, researchers at the University of Limerick published a meta-analysis in sports medicine looking at the effects of post-meal walking. The results were stunning. Walking just 2 to 5 minutes after a meal significantly reduced blood sugar spikes. Walking 10 minutes after a meal reduced post-meal glucose by 22%. Walking 30 minutes after a meal reduced post-meal glucose by 37% and reduced insulin demand by 41%. That last number matters. 41% less insulin means 41% less of the hormone that drives belly fat storage. Over months, This is the difference between gaining weight on the same diet and losing it. For pre-diabetics, post-meal walking has been shown to lower HbA1c, your 3-month average blood sugar, faster than metformin in some studies. Free, no side effects, no prescription. A lot of people ask if there's a supplement that mimics this effect. There isn't. Nothing replaces the mechanical contraction of large muscles after eating. But the protocol I'm about to give you costs nothing. Here's exactly how to do this. After every meal, finish your last bite, then start walking within 15 minutes. Not an hour later, not after you've watched TV, within 15 minutes. Walk at a comfortable pace. You should be able to talk, but not sing, about 2 to 3 miles per hour. Aim for 30 minutes after dinner, your largest meal. If you can do 10 to 15 minutes after lunch, even better. After breakfast, optional. If you can't walk for 30 minutes, do 10. If you can't do 10, do 5. The research shows even 2 minutes makes a measurable difference. There is no minimum that's too small. Walk outside if possible. Sunlight, fresh air, and visual movement amplify the benefits. But walking inside, around your house, even pacing in place, still works. Here's what happens when you commit to this for 30 days. Within 3 days, the post-meal heaviness is gone. You stop crashing in the afternoon. Within 1 week, your sleep deepens. Your blood sugar is more stable, which means less cortisol disruption at night. Within 2 weeks, your clothes start fitting differently around your waist. Visceral fat is the first fat to leave when insulin drops. Within 1 month, your fasting blood sugar measurably improves. If you're pre-diabetic, your numbers may shift back into the normal range. If you're diabetic, your medication needs may change. Talk to your doctor. This is the most powerful free habit you can build at any age, but especially after 50. For decades, you've been told weight loss requires the gym, sweating, suffering, hours of cardio. That was a lie. Your great-grandparents didn't go to gyms. They walked after meals because that's what people did. Their blood sugar stayed stable. Their waist stayed lean. Their mind stayed sharp into old age. We sit on couches after dinner and wonder why everything collapses after 50. You don't need a gym. You don't need a treadmill. You need 30 minutes after dinner. Try it tonight. Track how you feel after 1 week. Comment below and tell me when you're going to start. Today, tomorrow, this weekend.